Chris Bowen.
Chris Spire.
Brad Johnson.
Hey,
Bottom
Brad.
line Thursday. Hey, Brad.
Woohoo!
It's that time again.
Yes. What are we going to talk about?
You want to talk about some good news in the
Yes.
pharmacy space?
We need
We need some good news.
We need
It's a
some
way to
good
kick off the
news.
year.
So biosimilars, for the audience benefit, think of these biological drugs that these really smart people have created, like Humira. A lot of good cancer drugs are often biosimilars. I'm sorry, are specialty biologic drugs. Well, smart people have also come up with effectively like a generic version of these that they call biosimilars. That's the dumbed down Brad Johnson version. That's all I can do.
Dare I say the bottom line of
The bottom line.
Yes.
There you go. Very good. And they did a study, the Healthcare Cost Institute, sharp, independent think tank took a look at this, and they found that just the introduction of these biosimilars into that market has saved about $3 billion in a year's time.
Wow.
And many groups have already started to see that with Humira. Used to be the number one most expensive, well, on a per drug basis, not the most expensive, but the number one costly drug in the country. The biosimilar for that is about a tenth the price. Wow. And so given how many people are on Humira, and like we've seen with some major carriers, Wellmark, I've even seen like Express Scripts and others say, we're not going to cover the brand name any longer.
Right.
It's making a positive difference to the pharmacy.
3 billion. That's significant.
Yeah.
I think there are 7 biosimilars now on the market for Humira, and I've heard 2 of them actually are having better results.
Oh, that's incredible.
Less side effects, better outcomes. But yeah,
less money. That's awesome.
Yeah,
we were just talking in some prior meetings too about some of these other high cost drugs. I mean, there's so many others that were 50, 60, 70, 80,000 a year that, they're not necessarily available through international or manufacturer's assistance or any of those things, but that's what the member needs. So maybe that's coming too.
Yeah, and a big one I'm really interested in, a drug called Stelara, which is used often to treat Crohn's disease and other inflammatory conditions like that. It runs about 20 grand a month. So if you'll definitely know if you have one on your health plan, right? You guys know. I'm not telling you anything you don't know. But they're coming up with they've already come up with a biosimilar in that, and that should be launching next year.
Okay.
So I don't have a price yet, but I've got to think it's going to save a lot of money compared to that 20,000 a month. So
we're seeing a lot of Skyrizis, which are also in that autoimmune.
Yeah. I mean, life-changing drugs.
Yeah.
That came out. It's just, trying to figure out how do we do a purchase better, because it's not sustainable. Employers can't fork out 120 grand every single year and then some for one single member. It's just not feasible for at least the employers we're working with in our segment. So.
Yeah. I don't know too many that say, great, I got a $20,000 a month drug now to pay for. Even if you're a large employer,
you're still looking at that. That's a chunk of change. Yeah. So interesting to hear. More to come.
Great news. Thanks for sharing.
Yeah, you betcha. Have a good one, guys.
All right. Thanks, Brad.
We'll see you. Bye-bye.
See ya.